Yeah, Senator Vince, is here today donating, which is a wonderful example of leadership taking care of sick patients. What convalescent plasma does, when you are ill, your body develops a immunity to the virus and fights it off. You get better, but you've got this strength in you that you can actually give to somebody else. It's called passive immunity, when you transfer your antibodies, your immune proteins to someone else. It's a very old way of treating disease, but it's back popular because we don't have a lot of other tools right now for COVID. So we're relying on wonderful donors to come in and give a little bit of their health to somebody who needs to get out of the ICU or off a ventilator, that sort of thing. And we're really fortunate. We've had over 100 folks sign up for our registry, so people are hearing about this, and Oklahomans are so generous. In a week we were thinking of the Oklahoma bombing. This is just another way the Oklahoma standard is coming through, and we're really appreciative. And we're sending the units out really quickly right now. We're trying to get ahead. We'd love to have an inventory on our shelves, but right now every time we collect somebody, they give us 3 units, actually 3 doses usually, but those 3 doses fly out the door and hopefully are helping turn around the care for some patients out there. We do some testing beforehand, so some folks who test have to wait and come back again once they're clear of the virus. We do a nasal swab if you're 2 to 4 weeks out, and if that's not acceptable, if there's still an evidence of virus, we ask that person to come back again later. And if you're over 4 weeks out from the illness, you don't have to do that step. You can just donate once you get on the registry. We'll call you up, we'll schedule you to come in, and you'll be saving a life before you know it.
So
maybe 3.
So 100 people have signed up. How long have you been opening that registry?
That registry is just about a week old. So we've been getting a great outpouring of response. It's very easy. It's self-administered. It's my.bio-linked.org. That's way long, so you can go to our website, obi.org, which is way short, and hopefully get an answer there.
How many people do you know have recovered with your efforts at OBI? Do they get back to you with that?
Yeah, well, we asked for some feedback. Obviously, there's a lot of patient confidentiality. The early reports, we heard of 6 patients who were getting it, and I think 4 of those had some response. 3 of them are off the ventilators. Whether that's the plasma, whether they were going to recover on their own, we really don't know, but certainly this is one of the things doctors are giving because it just makes sense. Why not try it? And hopefully it is contributing to those successes. So anecdotally around the nation, a lot of responses are coming back that people are thinking they're seeing pretty good response, but the data hasn't been compiled yet, so we don't know the actual numbers. Hopefully within a week or maybe at the most 2, Mayo Clinic is coordinating the national trial with the FDA, so there are many, many patients getting this. We should see an early report from them fairly soon because they've got enough people doing this. They should have the first 100, 200 results back. They're probably being conservative because they don't want to jump too early and say it's yay or nay because they know everybody will jump on it. But again, we're expecting that report, that preliminary report, fairly soon.
With everything that's going on, what are we seeing in terms of need for blood right now?
Well, the governor just announced that elective surgeries are coming back next Friday, which is wonderful for those folks who've not been able to get hips taken care of and other procedures done. We're very nervous about it because right now we've been just keeping our head above water, keeping a good supply, but we're running 30% fewer procedures, fewer donations, fewer orders for blood. So we're running at about 2/3, and we're going to have to kick it up in a big hurry so that somebody doesn't have to wait on blood to get something done. That would be for us, almost like failure. We don't want anybody to wait on their medical care because blood's not available, but we're going to need a lot of folks to come out and help us. So we're going to be asking quite a bit over the next few weeks. You haven't heard much from us because we have been doing a pretty good job keeping up, but now will be the time to ask for that extra help. And we don't have schools to go to. Usually high schoolers are amazing, college kids are amazing for giving. But now they're all at home on their Zoom classes and they're not able to be grouped together for a blood drive. So we don't have businesses. They're all shut shuttered right now, most of the big ones, and then we need them to get back to work. And the first thing they probably think of when they get back to work isn't let's have a blood drive. They should, we'd love that, but we understand they want to get their businesses back going. So we've got kind of a gap in where we usually go for the big push on blood, so we're going to have to work really hard with the help of the public to get some blood in and help the folks who need surgery.